Okay, we'll start now. Hello, everyone. I'm Jose Antonio. I'm the Global Brand Manager of Primelase. Welcome all to today's webinar, the Success Strategies for Hair Removal with Primelase-Excellence. Before we get started, I would like to go over a few items so you know how to participate in today's event. You can listen to today's presentations in English, Spanish, and French by clicking on the interpretation icon located in the bottom of your screen. You will have the opportunity to submit text questions to today's presenters by typing your questions in the questions panel. You may send in your questions at any time. We will collect all the questions and address them during the question and answer session at the end of today's presentation. Please note that the clinical photos in these presentations are for educational purpose and should not be reused, kept, or shown to other people. Now, I would like to introduce our speaker for today's webinar, Dr. Erick Santaella, aesthetic physician from Mexico. Welcome, Dr. Erick.
Hello, everyone. Welcome to this webinar. I'm Dr. Erick Santaella. As Jose told you, I'm an aesthetic physician who lives in the north part of Mexico, in Monterrey. And I've been working already for several years with Sinclair and some of them with Primelase. And that's the reason what I'm talking about Primelase, which I believe that it's a powerful platform. And we're gonna dive into it just in a minute. If you want to know me better, the simplest way is to scan the QR code that you are looking up on your screen right now, because those are my social media, and I'm a very social media person. So if you want to know everything what I do, like in the clinic and out the clinic, you can just go ahead and scan the QR code, and it'll lead you right to my my social media. Okay. So we're going to start. The thing about Primelase is that I believe that it's a machine that has no comparison in the market, because we have one-of-a-kind power tool to do hair removal, but that's not only it. We are going to be able to address more treatments and more situations other than hair removal. And I know for a fact that in many countries, us doctors, we don't perform the hair removal treatments. We have our nurses or our staff to help us with that. Some of the countries in Middle East and in Asia, they do need by law to perform the treatments, like only doctors can perform it. But besides that, I believe that most of us, we delegate that work to our staff. So I'm gonna talk about this machine in a way that you are gonna find it very interesting, because I'm gonna do it in a very medical way. And the first thing that I want to do is do a dissection of the equipment, of the machinery, and let you guys know why I believe this is one of a kind tool for hair removal and other treatments. And before any one of you asked me, I did my research in the market, and I look up to all the different hair removal laser machines. And the thing is that I stayed with Primelase because I found the potential that it has as a machine. So we'll talk about the speed, the efficacy and the speed of the treatments, the versatility of the machine, the technology that it's behind the machine, like the crystal freeze technology, and the safety and efficacy, also the durability of the equipment. So first of all, I'd like to tell you about how powerful this is. We know that it depends, depending the power, it's going to be the outcome in our patients. So I can tell you that Primelase has a diode laser of 300 watts per bar. That's actually very powerful. And when we're talking about power, sometimes you say, well, yeah, but I don't need that much power. We'll see along the presentation that the more power we have, the better results we'll get and in the less time possible. So that's one of the main things that I found out, that Primelase is one of the few machines that does hair removal in the market and that has that much power. It has 16 diodes of 300 watts, so that makes 4,800 watts in total to use it on your patients. So it's a very powerful, and when we're talking about power, that can be translated into time. And we know that when we're at our clinics, we need to have time-efficient treatments to have our patients happy, because sometimes the patient only has a few minutes in between lunchtime and office and going for the kids, and actually having a hair removal session in less than 30 minutes, sometimes it's a blessing. So when we're talking about power, we can actually turn it towards time. And that also traduces into when we're talking about how time consuming it could be, a full body hair removal, and how much time will we need to block that space on our schedule in the clinic. We actually see that with Primelase, we kind of reduce that time consumption on our agendas at the clinic, and that makes a more efficient workflow with our personnel and our staff. And now, one of the main technologies of Primelase is the USP, or ultra short pulse technology. What is this? Well, we know that the lasers can be very short or as long as we need them to be. The thing is that when we're talking about hair removal, the more time of exposure the follicle has to the laser, the more chances to burn our patient, to make the appearance of residual hair, or to have the paradoxical hair effect. Because we're shooting the laser to the follicle in a very long time period with no enough energy. So sometimes if the follicle is resistant to hair removal with laser, and you're just bombing the follicle with very small amounts of energy with a very long period of time, you won't have any result. So the ultra short pulse gives us the ability to concentrate in a very small time frame, a very high energy. And that's going to traduce or translate into the burning of the entire follicle. So we're gonna reach to the treatment scope, which is going to be over 50 degrees in a fraction of a second, when with other technologies, we need more time to get to that energy delivered into the follicle, and we have risks when we're talking about more time of exposure to the laser. So the ultra short pulse is going to help us to make an even distribution of the energy during the entire pulse. We don't have this slope in the start and the slope in the ending of the shooting. We have a very coherent laser beam that aims towards the entire follicle. We don't have overshots, and it's very stable, so we don't have this overlapping of different shootings in the same time frame of exposure. And we're gonna be fast because we only have to deliver one shot and then move to the next area, and that's gonna be very efficient. So when we are talking about the instant popcorn effect that you might heard, or if not, I'll explain it to you. The instant popcorn effect is when we hear to the follicle just beeping and burning at the moment. When we're talking about other diodes, normally we don't listen to this snap of energy to the follicle. It's a very silent treatment. those of you who had alexandrite lasers, you can know what I mean about the popcorn effect, because alexandrite, it's a laser that does the popcorn effect almost in every single patient, that we listen to the hair follicle burning and snapping. So we might have this with the ultra short pulse, with the benefit that we're doing a very effective and safety treatment. Another quality of Primelase is the spot shape. We know that there are different spot shapes in the market and in different machines, although there is an uneven heating on the spot, and that's going to create areas where there is not enough heat from the laser, and those areas are the ones that can have, at the end of the treatment, residual hair, or you can start seeing the paradoxical hair effect, because you're not getting to the entire area with the same heat or with the same energy delivery as you are on the middle. So Primelase has a homogeneous spot shape, and that's going to help us to create very specific areas of heating. And we'll see in one of the cases that I'll present to you how precise and square or rectangle shape gives us the laser. It's a very even heating on the skin that we're treating. So actually, we'll have a very nice result. And sometimes they ask me, well, do you overlap? We do an overlap of the 10% sometimes, but I try to tell my nurses not to do so because we don't need it. We'll see in other technologies that they recommend to do 50% overlapping of the spot because they have these Gaussian or round spot shapes, and they'll need to overlap in order to evenly distribute the laser on the surface of the skin. So we don't have to do a lot of overlapping with Primelase, which is actually very nice because we don't overheat some of the areas. We have high speed at all fluences. So we have the static mode, which can go from 1 hertz to up to 3 hertz, and the dynamic mode, which is 10 hertz. So when we're talking about the static mode, we can do very small, short shots, towards the skin. But if the technician, the nurse, or the staff who is doing the treatment has already gained a lot of knowledge about how to use it, they can move towards 3 hertz, and that's going to aim to reduce the time of the treatment. So they'll do the beep, beep, beep very continuously. In 3 hertz, it's very fast, even though you might think 3 hertz is very slow. It is not. And because we don't have to do the overlapping, we'll move a very nice pace, and we'll have a very small time consuming treatment. And when we're talking about the dynamic mode, I use it mainly on the big areas, the back, the legs, the full arms, the chest. And sometimes when the patient feels a little bit of discomfort with the static mode, I just move it towards dynamic mode, and I can deliver less amount of energy in very numerous repetitions, and that'll help me also with the comfort of the treatment. And that's going to help me to increase also my revenue, because I'll have more patients in less time, in the clinic schedule. Another thing that is very interesting to talk about, it's about the wavelengths. You know that there are different types of hair removal machines in the market. We have alexandrite, we have diode, we have ND-YAG. And the thing is that we need to understand what's the aim of every single one of those beams, because when we're talking about laser, we know that it is very specific. So we need to understand the depth of the laser in order for us to choose our tool accordingly. So when we're talking about how deep does the laser penetrates, we have alexandrite that goes all the way to the reticular dermis, and this is a 755 nanometer wavelength. We have the diode, which is at 810 nanometers. Blend is very interesting because it combines Alex or alexandrite, diode, and YAG in order to improve the result and outcome of the treatment. That's the only reason why it's combined, because we know that diode has more affinity to darker follicles, but it can be used in darker skin types. Alexandrite does well with Caucasian patients, but it does not so well with skin type 5 or 6. And yeah, it does not do well with very light skin tones, but it can be used with other skin tones that are darker. The thing is that it's going to be a little bit painful. So we need to know what our aim is in order to choose what are we going to use. For hair removal in Primelase, we have different hand pieces, and we'll see it in a little bit. So the spot sizes, that's another perk of having Primelase. We can choose all of the spot sizes that we want in order to have different treatment areas and different treatment scopes, you know. So for the people that only does facial hair removal, well, you can use a 20:9 spot shape, or the people like me that we do a lot of body hair removal, we choose from 30:9 or 30:17 to aim to have a bigger spot size. The 4:3, it's very specific because it's going to help us with the vascular lesions treatment, and I'll be talking to you about that in a second, but it's a very narrow and a small headpiece that it's going to help us to aim directly the lesion and not to harm the healthy skin. So here's what I was talking about. When we're talking about the lasers, the wavelengths, and the tissue that is going to be the goal of the laser, which is the chromophore, we have that alexandrite has affinity for melanin, but very low affinity for oxyhemoglobin and practically none to water. When the diode, it's a very standard laser to treat hair because it does have affinity for melanin, but it also has affinity for oxyhemoglobin and a little bit of water. And when we're treating a follicle, we know that if we can get to the blood vessels surrounding the hair follicle and also the melanin, we can have a faster result because we're actually targeting specifically the unity of the follicle, the hair follicle. The blend technology helps us when we have different types of skin types of our patients in the clinic. When we do have very light skin tone patients and very dark skin tone patients, we might as well use a blend because it's going to help us to improve the outcomes of the treatment without having to add up energy. And that's something that happens with when you're choosing alexandrite or diode. Sometimes it's going to be resistant to the hair removal because of the skin type, but if you have blend, you have the certainty that you'll have different wavelengths that can adjust to the type of your patient. And the YAG, which actually is going to give us 1060 nanometers, and that's aimed for the vascular lesions. And now the indications, depending on what are you choosing, because you, as I told you, you can choose your handpiece with only alexandrite or with diode or with a blend technology, and you'll have different treatment because of the combination of the lasers in the case of blend, or because you have a very specific laser talking about Alex or diode. So when we're talking about hair removal, we're talking about the alexandrite, the diode, and the blend. All of them can do the hair removal treatment as we were talking about. When we're talking about inflammatory or follicular acne, We can do it with Alex in very light skin tones. We can do it with diode, or we can do it with blend also. Pigmented benign lesions, such as the lentiginous, we can actually do it with alexandrite or diode. We don't recommend it with blend because we have also the 1060 included there, and it can hurt and it can actually leave a post-inflammatory pigmentation. And when we're talking about vascular lesions, there is only one handpiece that can be used for that, which is the YAG 1060 that has a spot size of 4x3. Now, the operation modes, we were talking about the static mode that can go from 1 hertz to 3 hertz, and that's depending on the area we're treating and the ability of the technician or the personnel which is doing the treatment. That's the gold standard for hair removal, the static mode of short pulses, very singular pulses. And we have 3 hertz for all the fluences. Other machines in the market don't have 3 hertz to be treating the patients with. So that makes a very slow treatment session. The automatic mode, which actually helps us to determine the achievable pulse rate, choosing depending on the fluence. That's kind of like a safety. I always tell people that that's a safety that Primelase has, that the automatic mode is going to help us to have the best parameters for our patients and won't have the risk of miscalculating and deliver more energy than we should. We also have that this mode is very flexible because we can modify the parameters as much as we want, and it's going to be all the time efficient. Even though the patient is a very dark skin tone and we need to bring down the energy of the fluence of the treatment, we'll have the ability to deliver an effective treatment and also a very safe one. And when we're talking about the dynamic mode, this is like painting, you know, we can do all the way from 5 hertz to 10 hertz. 10 hertz is very fast, and the areas, the big areas such as the back, like in the image, or the legs, it's going to be a 3, 4, 5 minute long treatment when we will take even 30 minutes per leg with the static mode. So this is a bliss when we're talking about big areas, because these will help us to reduce the density in the first sessions of hair. And you know, in the session number 5, 6, or 7, we're just gonna use the static mode just to retouch the areas and get rid of those small areas that might still have growth of hair follicles. But the thing is that with dynamic mode, we can actually achieve an even faster result, and the patient will start noticing it after a few weeks. The first thing the patients will notice is that the hair is not growing as fast and as thick as it used to. And when we're using this treatment, practically all the patients fall asleep because it doesn't hurt. You don't feel anything. In my personal experience, when I tried that one, I did it on my back, and actually I fell asleep in the sessions because you don't feel anything but a little bit of cold, which brings me to my next slide, which is a contact cooling. Thus, all the machines nowadays have the cooling technology. The thing is that it's not adaptive, and it actually can unfreeze, that the tip can unfreeze, and the patient will feel all of it. Primelase has a crystal freeze technology, which is based on a sapphire that makes a even cooling, and actually it adjusts from 5 degrees to 25 degrees. So at the beginning of the treatment, the sapphire will be 5 degrees Celsius. And while we start doing the treatment, it can rise up all the way to 25. But in order to achieve one, the relaxation time needed for the skin to cool off, 2, a very nice analgesic effect on the skin, so the patient won't feel practically anything. And this cooling system, it's on the device, not on the handpiece. So this is going to be very convenient when we're talking about long sessions of hair removal, because when the handpiece is the one that makes all the cooling effect, it doesn't have the ability to maintain a certain ratio of cooling, and Primelase has this ability because the cooling comes all the way from the machine. So this is a bliss when we're talking about maintaining an entire area cool down for the relaxation time to kick in, and that will make also a safer treatment. And at the same time, just the comfort of our patients, that they won't feel like if the handpiece gets too hot because of a very long session, they'll start feeling a discomfort. So with Primelase, we have the ability to control the even cooling of the tip because it's contained in the machinery. One of the other advantages that I found out, that not all of the companies that make lasers have, is the clinical studies. And that's coming from me. I love to publish, I love to research. And when something, a new treatment or a new machine, doesn't have this clinical background to back it up, I just turn my side to other side, because the thing is that we need to have clinical studies to know that the technology is safe, that it's been proved, that it's being used, and that we have the safetiness to offer to our patients because the technology has been tested before. So Primelase does have clinical studies comparing the thermal modeling, the different hand pieces, and actually it compares it to other machineries. And that's very convenient when we're deciding whether to buy another Primelase or just go ahead and buy another one. Well, we have comparative studies that will help us to know how powerful the Primelase platform is, and how good the outcomes are. Because when we're talking about technology, maybe it's safe, maybe it doesn't hurt, but when we're talking about results, patients want results, and when we tell them, that area is going to take probably 15 to 20 sessions to be hairless. Well, the thing is that the patient maybe doesn't have 20 sessions to wait, or sometimes they'll just say, what, but the thing is that it's going to cost me a lot, because those are 20 sessions of hair removal where I can go somewhere else where they have Primelase, and you can get rid of the hair in between 6 to 8 sessions. So actually, that's a very standard point of view from our patients. So when I chose Primelase, I did my research on this, and one of the clinical studies helps us to know that in very few sessions we have over 50% of reduction of the hair follicles. So actually, that's very convenient both for the patient and for me, because I can have even more patients treated with one single machine. So now we're going to talk about the clinical cases. As Jose told you at the beginning of the session, these cases are for your eyes only, for educational purposes only, because I'll show you different cases on what you can do and what I recommend to do in different situations.